Okay. Yes, sorry for the technical glitch. There is some reason why the video paused. Can you hear me, Dr. Sonali?
Yes, I can hear
Yes,
you. I can hear you,
yes,
Shukriya.
yes.
Yeah.
All right.
Break के बाद. Okay.
Yes, I think there was a short commercial break. Oh, sorry. Yes, and I have also now requested Dr. Rajan Shankaran to join us so that we can you go online with him. Yes,
Yes.
yeah. So, all right. And we have our viewers joining us back online. Thank you all so we appreciate your patience and thank you all for joining us back online. All right. So, Dr. Sonali, could you tell us of any case example you would like to share with us today?
Yeah. Yeah. Case example, I will share a case of gout where the patient experienced at a deepest level as if his life is in a closed compartment, airtight compartment, and he felt as if his pains are making him airtight. It is nothing he can do in his life. He's so constricted, so restricted that he feels absolutely as if the gas is being and inside and it wants to burst out and come out with an explosion.
Yeah.
And from this is the uniqueness of homeopathy, how each person perception of pain and experience is different, and so the remedy will be different.
Yeah.
And glonine, a remedy from homeopathic remedy, glonine was prescribed and he felt much better.
Oh,
So good morning, sir. Yeah.
that is lovely to know, Dr.
Yeah.
Sonali. Yes.
Yeah.
Yeah. And I now welcome Dr. Rajan Shankaran. Uh, Good afternoon, Doctor. And we have Dr. Sonali and Dr. Rajan Shankaran who are going to talk about these bone and spine issues. Yes, Dr. Shankaran, what would you like to share with us today?
Well, I could always sing you a nice raga if you like.
Yes. Will that help us in our, in relieving us from the joint pains, Dr. Shankaran?
Well,
He's already getting a lot of hard. There are good hormones secreted already which relieve pain.
Yes, yes, yes. Yes, that is so true. That is so true, Dr. Sonali. I think when we were online, we didn't get any, but now they all are coming through very, very clearly. I'm glad about that. Yes. So,
jealous.
Dr. Sonali, Dr. Shankaran, please go ahead and take this discussion further. Thank you.
Well, we can talk of many aspects. For example, in fractures, etc., we have great remedies to improve the healing and
Yes,
make it faster.
yes.
And in sprains and strains, in diseases such as slip disc, etc., I have seen really amazing results that people who have advised surgery and who has lot of pain and difficulty, etc., they recover very nicely with acute homeopathic remedies also. However, one of the best areas for homeopathy is the chronic joint problems, such as rheumatoid arthritis and ankylosing spondylitis. Now, these are extremely difficult diseases to treat as far as modern medicine is concerned, because basically they are autoimmune conditions where the immune system of the body is fighting with the body itself. And how does one
Yeah.
correct this malfunctioning of the immune system? When we try to see that, modern medicine offers steroids and immunosuppressants, but basically they are short term and they don't address the deep issue. When we try to address the deep issue, we need to see that the immune system is a part of the whole organism, which includes the mind and the nervous system and the hormonal system. It's all one thing, you see. It's not divided into immune and system and mind and like that. It's all part of one mechanism, one whole organism. And so
Mm-hmm.
in homeopathy, we have a holistic approach looking at how the person thinks, feels, reacts, fears, dreams, stresses, etc., how he eats, drinks, sleeps, dreams, etc. And looking at all of that, we use our homeopathic materia medica knowledge of remedies as well as the latest advances in terms of sensation, kingdoms, whether the person behaves in a manner that resembles like an animal remedy or a plant remedy or a mineral remedy. These are the most recent advances. So we use these to our advantage in finding the precise remedy that corrects not only the joints, but the person's way of thinking, feeling, living, and a whole, sometimes people say, I came to you for backache, but I don't know how my heart problem also got better. I don't know how my stress also got better. So that
Yes.
is the holistic approach. And as far as I know, only homeopathic medicine has this kind of approach. And we see really very, very encouraging results. But I must also say to people that you do not expect results overnight. That all this requires a lot of study and dedication and work on our part, and cooperation and patience on your part. And if we work together, then in a reasonable amount of time, and you must give us in chronic cases at least 1 to 2 years, and we will
Mm-hmm.
be able to show you significant changes in terms of reduction of your medication, your pain, your general well-being, etc., etc. So I highly, highly recommend that homeopathy is the treatment of choice in these kind of cases.
Yes. Thank you so much for clarifying that, Dr. Shankaran. Because with all the available treatments, that are available to all of us today, why choose homeopathy for this? This is very well clarified by you. And you have trained also Dr. Sonali, who is one of the esteemed doctors on the online portal. And can you talk a little bit, Dr. Shankaran, about the online portal and your vision about the online portal?
Well, because homeopathy, the success of it depends on the quality, the training, the skill, the expertise, the dedication, and the sincerity of the homeopath. It's
Right.
a very, very individualized medicine.
Hmm.
So there is no standard treatment. So each doctor has to use his skill in knowing the deepest level of the pattern of that patient. And
Right.
for this, we have developed cutting edge advances in the understanding of people and the understanding of remedies. And I thought, you see, so many people come to me for treatment. I'm not able to accommodate because I have limitation in terms of time and capability to take so many cases. So why should I not create a portal where there is a group of people whom I have trained and I trust very, very, very clearly. I trust them that they have
Yes.
learned all these things. They are very fully conversant, aware, and experienced,
Yes.
and whom I can entrust the patient's care to. And so we created a group of these four very, very closely knit doctors, and
Right.
so that we can give the advantage of latest and good homeopathy to more and more number of people. And as
Yes.
I find more sincere people, I may add them. But currently, I know that these four doctors I can thoroughly trust. I've been working with them for, if not years, at least maybe a decade or two, and they
Yes.
are fully, fully trustworthy, and they can really extend the advantages of all these advances that we have made to a far
Right.
larger number of people.
Yes. Yes. That is wonderful, Dr. Shankaran. So nice to know that. And I also would request our audience here, if you all have any questions for Dr. Rajan Shankaran or for Dr. Sonali Bhonsle, please write it in the chat box and they will try their best to answer it. Thank you so much. Yes. Okay. And so, Dr. Sonali, you were telling us about how you have also treated so many cases of these sort of issues where there are bone issues and there are joint issues. And with homeopathy, you've got very, very good results, right, over time. Yes?
Yes, yes.
But how do
As
I,
sir has, yes, sorry,
no,
yeah,
no,
please
no,
continue.
please go on, please go on. Yes.
So, as sir has rightly put, it is the skill of the homeopath. So, our training is very important
Yes,
because, and the cooperation from the patient.
yes,
I always tell my patients, your cooperation because they are able to tell exactly the kind of sensation of the pain, what increases it, how are they most comforted. So, cooperation of the patient, long-term follow-up, and skill of the homeopath. So our training as a homeopath is extremely important to bring about the healing.
right, right. Right. Yes, that is very important. So, would you say, Dr. Sonali, two people suffering from the similar problem can receive two very different remedies? Are you saying, is that also possible?
Yeah, yeah, yeah. Because pain is a unique phenomenon, pain or our disease or our distress. It is very individualistic.
Yes.
So it is not one remedy for it might be RA or any of the musculoskeletal condition. Two patients can receive the remedy as per their adaptation and to the illness. So the remedies will be different.
Yes.
And that's why 1 hour or more is invested in thoroughly investigating the patient and the journey of their illness. And that we refer to as case taking, which is very crucial. Not only the medicine, but how well the case has been taken.
Yes, yes, yes. We have heard a lot about Dr. Shankaran's unique method of case taking, which you have, repeatedly said has been a very, very instrumental in getting to the accurate remedy and as well as healing for the patient, right? Overall.
Yes, yes. Because many patients tell after giving the case only they feel better after the case taking process. So the journey of healing begins from the case taking
Oh,
process,
lovely.
and the remedy further adds to the healing mechanism. It has to be so healing. So patient should go after case taking with a feeling I'm feeling relief. That is the true art of case.
Oh, that is lovely, Dr. Sonali. Yes, I can just imagine somebody having a sense of relief when they walk out of your clinic just after talking to you. And that is so wonderful to know. So, all of you here present here today, please don't hesitate to get in touch with Dr. Sonali Bhonsle and from the online portal, which is www.drshankaranhomeopathy.com. And please don't hesitate to email us care, that is CARE, at drshankaranhomeopathy.com. So that's the way you can reach us, and the best doctors on the panel will get in touch with you, and you can have your appointment with them from the comfort of your homes. Yes. So thank you so much. Any last words, Dr. Shankaran, to end our lovely session?
Well, healing is a process which not only consists of taking medicines but also following the right lifestyle in terms of diet, in terms of exercise, in terms of meditation, in terms of spiritual evolution, in terms of witnessing your own pattern and your stress. All this, along with the right homeopathic treatment, can take you towards healing as opposed to symptomatic or pain relief. And I think this is a path that you should see and pursue rather than put yourself in the hands of continuous medication, which has side effects, which has short term effects, and which
Yes.
everybody knows is not a long term solution. So let's go towards true healing, which consists of all these factors that I told you.
Yes, yes, yes. Thank you so much, Dr. Shankaran. And yes, and thank you all. And if you all have any questions, please type it in the chat box and we shall try our best to answer it. Or best is, if you want to get in touch with our doctors, please email care at drshankaranhomeopathy.com. Okay, thank you, Dr. Sonali, for your invaluable inputs. Thank you so much, Dr. Rajesh Shankar.
Thank you.
Thank you so
Yeah,
much,
thank you, Sukrita. Actually, you conducted it so well, and we were so at our ease explaining how homeopathy and holistic healing is the need of the hour today. And pandemic has taught us the more. We dealt with most of our challenges in last year, I think, all of us.
Yes.
And thank you, Shukrita. Thank you, sir, for always being there with all of us. And our journey continues.
Yes, and
Yeah.
everyone here wanted to wish both of you a very happy Teachers' Day. So, on behalf of all our viewers, happy Teachers' Day to Dr. Sonali Bhonsle and Dr. Rajan Shankaran. Thank you so much. Okay,
Thank you.
thank you.